I'd like to thank the organizers for inviting me and to speak to you about what's going on in our region of the part of the world. We are in Doha, which is the capital of Qatar. Qatar is a small country in the Arabian Gulf. And it is located in the Arabian Gulf, and it's one of the smaller countries in this region. If you're a soccer fan, maybe we'll see you in 2022, which is it's going to host the World Cup of soccer in there. To have that done, we need to invite lots of people. So our population has increased tremendously over the few years to reaching now almost 2 million people. To us is actually as a large number since our citizens only 250,000. Qatar has the highest GDP per capita, and Doha is being the largest city, which houses about 60% of the population in Doha. Now, with that comes the challenges of obesity and diabetes, which is very common in our region, both in the Gulf region and as well as in Qatar. About 75% of the Qataris are overweight, and 40% of them are obese or morbidly obese. Some experts predict about 73% of Qatari ladies and 69% of men, Qatari men, will be obese in 2015. And that's the tax that we have to pay for having a rich country. As well, Qatar is not just the richest country, it also has the highest rate of, among the GCC countries, of a 30% increase in comparing a decade ago when it comes to the prevalence of diabetes. And it's, as you see over there, is number 8 in the world chart of prevalence of diabetes. Marriages between blood relatives, sedentary lifestyles, rational food habits are cited to be some of the reasons of having the high incidence of diabetes among Qataris. We're also seeing the Qatari children's developing type 2 diabetes, which is normally an adult type of disease. To face that, we only have Hamad Medical Corporation, which is the primary public healthcare provider in the state of Qatar. It's composed of Hamad General Hospital, which has only 624 beds, and 9 other sister hospitals, which totaling 950 beds in the whole country, with 24 primary healthcare centers. Now, this is just not a statistics to tell us about what's going on in diabetes, but this is only in a small unit, one diabetic unit in Hamad General Hospital, and this is the number of diabetic patients seen during that time. Also, podiatry was asked to join in 1999 in this country with 1 room, and throughout the years it has increased to a 4-room unit or a small department with a small procedure room for emergency cases. The main factor for this clinic is it's open almost 24/7. We're open evening and day times, also weekend and holidays, to provide the service for patients who really need it, and we all know that it needs it. We also cover all the other hospitals, since we are the only clinic that's available in the country to give the service for the diabetic patients, or diabetic foot. You see the number over here. 1999, it was opened lately, and I joined the Hamad Medical Corporation myself in 2006, and at the later stage. During that time, we started inviting our colleagues, healthcare providers from the hospitals and the neighbor hospitals, as well as the primary healthcare centers, to inform them about the service that we can provide for these patients and what we can offer their patients. But we didn't really expect that our number, it will go to 100% in the following year. by seeing 12,000 patients or more than that in 1 year. And about 70% of those patients have an active ulcer. The following years stayed, I think, plateaued and 12,000 patients per year. And the reason is, I think, because of space constraints and professionals who are able to work in that clinic. It's just we're not able to cope more than the 12,000 patients. But I think the numbers are much more. We face a few challenges in the state of Qatar. One of it is as you might have realized, that having 2 million people in about 1,500 bed is very small. If you compare it to the United States, the prevalence of diabetes is 20%, which is threefold higher than the U.S. Although we're able to hire more physicians, so we're decreasing increasing the ratio of physician to population ratio, but we still lack in the hospital bed to population, with only 44% of that in the United States. And we all know that diabetic foot ulceration is one of the main reasons hospitalization with people with diabetes, with the estimated 25% of lifetime risk. The other challenges that we face is that almost 60% of this population that come to our country, they don't speak the local language nor English language. So this places a serious barrier in education and communication. Now, we also, our local patients are still believing in this traditional medicine, which is herbal treatments and applied by non-expert people. And this places another serious challenge by providing a timely care in patients with diabetes with foot ulcers. So we get patients walk into a clinic like that, which will be very hard for us to manage and try to save that limb. So what we did, our strategical, we addressed it by hiring a multi-language staff who speak the language of the patients who are needing our treatment. We had a patient education by providing awareness for patients and their families and the signs and dangers of diabetic foot. Public awareness by inviting students who are interested in healthcare, as well as we place them in our clinic and let them see what we do and what is the danger of diabetes, to spread the word. Local programs and the newspapers, we provide periodical topics on a local newspaper and local radio shows, and also the television, to inform the public about our service, as well as the danger and what they can see with diabetes. And lastly, but not last, least is the research. We have combined ourselves with our international colleagues to collaborate on promoting the research to prevent the ulcer from happening, and to provide a personalized care that is suitable for the region. Now, our research, we have 3 projects, active projects. The first one is called the Smart Socks. And now, with this idea, we were focusing on the reason in this research, what we need to start to properly assess these patients. And most of our assessment is done subjectively. Sometimes we may miss very important information. With that, we cannot orientally manage what we cannot measure, according to the famous word of Dr. Armstrong. So we collaborated ourselves with the University of Arizona and Dr. Armstrong and his team in this early transitional innovation research to try to better assess the foot through this Smart Sock project. Now, this Smart Sock project is funded by Qatar National Research Foundation. and it's based on smart textile. Now, it's a normal sock, as you see, and it identifies the region that we were interested in, whether that region is at risk or not. We measure 3 major factors that are associated with the risk of development of foot ulcers. That is temperature, pressure, as well as joint angle. The technology is developed by a group of engineers in the University of Arizona, and it works on the basis of fiber optics. And it measures the changes in wavelength. This changes in wavelength, it allows us to assess the magnitude of a pressure that's placed in the region that we're interested in seeing. Also, the temperature changes, as well as the joint angle, with the big toe, whether the big toe has a good range of motion or not. Now, why is this thing interesting for us? Is that most of our patients that come to our clinic, they come wearing sandal rather than proper diabetic shoes, which will be very hard for us to place the insert as a tool of assessing the foot or the pressure area. So placing the sock on the patient and evaluating them, it will be much easier. And another innovation about this technology, it can measure the thermal response. And that, we see quite a few patients with acute charcoal that come to our clinic. And wearing the sock, we can assess the temperature changes. And by seeing where the temperature is increased, we can offload that area properly and prevent the ulcer from developing. Now, this is a validation phase of the smart socks. We see where the patient is actually walking where the pressure is area, as you will see over here. The validation phase is done in our clinic right now as we speak. And you can see over here that the patient is wearing the sock, and this is ongoing research, and we're hoping that we can have this technology to be transformed to for a home usage. Our second research is the plantar stimulation, and this is using a new generation of wearable technology. We know that by placing this device, which delivers a comfortable level of electrical stimulation to the plantar aspect of the patient's foot, we know that electrical stimulation enhances circulation. And with the help of work of Dr. Lavery and his colleague in the University of Texas, we know it actually accelerates the healing process. And it also decreased the pain that is associated with peripheral neuropathy. Wearing this plantar stimulation, we asked this patient to go ahead and use this for 1 hour each night before going to bed on each foot, and to deliver a comfortable stimulation, electrical stimulation to the foot. Now, by using this for 3 weeks, we found a great collection of data that shows us about 22% increase in balance of the patient, as well as a decrease in the proprioception, decrease in the vibratory proprioception of this patient. And this is an ongoing study. What we're trying to find is, would these patients be less likely to develop an ulcer by increasing the blood supply or not? Our third research is named a personalized exercise using a virtual reality. We are trying to motivate our patient to be more active. We know that diabetes is initiated by decrease of activity, so we need to encourage our patient to be more active. But we are dealing with patients who are at risk of developing ulcers. So we don't want them to be too active. So if we can develop a personalized exercise that is in a safe environment, okay, and promote their activities, it may be help. We see, and when we evaluate in these patients, that when they close in their eyes, they have poor balance, and this poor balance may be a reason why these patients become less motivated to do any activities. They may be afraid to fall down, so they may be not active. Now, if they are inactive, they may have a poor blood supply or low blood flow, and that may lead to ulceration. And if they develop an ulcer, it may be very hard to heal it. This technology is, we're working with a group of engineers in the University of Arizona that is interested in developing this new generation of exercise based on virtual reality. Now, what is unique about this technology is designed to exercise for the lower extremity of the patient in a safe environment and a fun environment. What this patient is wearing these body-worn sensors and is attached to the computer, as you see over there. The patient observes the obstacle on the computer, and there is an avatar of the patient's lower extremity, and the patient can maneuver this avatar to train him to negotiate a front crossing of an obstacle. And the patient can actually move his foot, so therefore he's exercising, and in the same time is in a safe environment. What we observed in our this randomized controlled trial of 36 patients, at 4 weeks, the patient is asked to come twice weekly. And what we've seen, that the patient actually have increased in balance by 76% when they're in eyes open condition, and a 45% in eyes closed condition, which is a very significant when comparing to the control group. In conclusion, I would like to say that obesity and diabetes are a very serious challenge in our region. We have a large non-local population, which lead to a huge barrier in language and communication, and the level of education of our general public. The increased challenges of diabetes, which increase the challenge of diabetes, foot ulcer management, both in the Gulf and in Qatar. By hiring the proper speaking professionals, as well as the public education, along with interdisciplinary transitional research. Our international collaboration, with that, we can translate the research from the Western countries to our region and tailor it to fit our need. And in short, I think multidisciplinary research is the key to our success in the region, and these are my collaborating. Thank you.